Kawasaki disease is a condition that mainly affects children under the age of 5. It's also known as mucocutaneous lymph node syndrome. The characteristic symptoms are a high temperature that lasts for 5 days or more, with a rash, swollen glands in the neck, dry, cracked lips, red fingers or toes, red eyes. After a few weeks, and with the correct treatment, the symptoms become less severe, but it can take longer than this in some children. Complications. The symptoms of Kawasaki disease usually develop in 3 phases over a 6-week period. Coronavirus. While everyone is being told to stay at home, it can be hard to know what to do if your child is unwell. It's important to trust your instincts and get medical help if you need it. Phase 1, acute, weeks 1 to 2. Your child's symptoms will appear suddenly and may be severe. Your child may be very irritable. High temperature. The first and most common symptom of Kawasaki disease is usually a high temperature, fever, of 38 C or above. The fever can come on quickly and doesn't respond to antibiotics or medicines typically used to reduce a fever, such as ibuprofen or paracetamol. Your child's fever will usually last for at least 5 days, but it can last for around 11 days without the proper treatment. In some rare cases, the fever can last for as long as 3 to 4 weeks. Your child's body temperature could possibly reach a high of 40 C. Rash. Your child will almost always have a skin rash. This can vary in appearance from child to child. Read more about skin rashes in children. Hands and feet. The skin on your child's fingers or toes may become red or hard, and their hands and feet may swell up. Your child may feel their hands and feet are tender and painful to touch or put weight on, so they may be reluctant to walk or crawl while these symptoms persist. Conjunctival injection. Conjunctival injection is where the whites of the eyes become red and swollen. Both eyes are usually affected, but the condition isn't painful. Unlike conjunctivitis, where the thin layer of cells that cover the white part of the eye, conjunctiva, becomes inflamed, fluid doesn't leak from the eyes in conjunctival injection. Lips, mouth, throat and tongue. Your child's lips may be red, dry or cracked. They may also swell up and peel or bleed. The inside of your child's mouth and throat may also be inflamed. Their tongue may be red, swollen and covered in small lumps, also known as strawberry tongue. Swollen lymph glands. If you gently feel your child's neck, you may be able to feel swollen lumps, usually on one side. The lumps could be swollen lymph glands. Read more about the complications of Kawasaki disease. Phase 2, sub-acute, weeks 2 to 4. During the sub-acute phase, your child's symptoms will become less severe, but may last a while. The fever should subside, but your child may still be irritable and in considerable pain. Symptoms during the second phase of Kawasaki disease may include abdominal pain, vomiting, diarrhea, urine that contains pus, feeling drowsy and lacking energy, lethargic, headache, joint pain and swollen joints, yellowing of the skin and the whites of the eyes, jaundice, peeling skin on the fingers and toes, and sometimes also on the palms of the hands or the soles of the feet. Phase 3, convalescent, weeks 4 to 6. Your child will begin to recover during the third phase of Kawasaki disease, which is known as the convalescent phase. Your child's symptoms should begin to improve and all signs of the illness should eventually disappear. But your child may still have a lack of energy and become easily tired during this time. Treating Kawasaki disease. Kawasaki disease is always treated in hospital. It's best if treatment begins as soon as possible. The sooner treatment starts, the quicker the recovery time and there's less risk of complications developing. Intravenous immunoglobulin (IVIG), a solution of antibodies, and aspirin are the 2 main medicines used to treat Kawasaki disease. Kawasaki disease is treated in hospital as it can cause serious complications. Treatment should begin as soon as possible. It may take longer for your child to recover if Kawasaki disease isn't treated promptly. Their risk of developing complications will also be increased. The 2 main treatments for Kawasaki disease are aspirin, intravenous immunoglobulin. Aspirin. Your child may be prescribed aspirin if they have Kawasaki disease. This is one of the few occasions where aspirin may be recommended for a child under 16 years old. Never give your child aspirin, unless it's prescribed by a healthcare professional. It can cause side effects, including Reye's syndrome. Aspirin is a non-steroidal anti-inflammatory drug (NSAID). It's used to treat Kawasaki disease because it can ease pain and discomfort. It can help reduce a high temperature, fever. At high doses, aspirin is an anti-inflammatory, it reduces swelling. At low doses, aspirin is an antiplatelet, it prevents blood clots forming. The dose of aspirin your child is prescribed and how long they need to take it for depends on their symptoms. They'll probably be given high-dose aspirin until their fever subsides. They may then be prescribed low-dose aspirin until 6 to 8 weeks after the start of their symptoms. This is to reduce blood clots if there are problems developing in the blood vessels that supply blood to the heart. Intravenous immunoglobulin. Intravenous immunoglobulin is also called IVIG. Immunoglobulin is a solution of antibodies taken from healthy donors. Intravenous means it's injected directly into a vein. Antibodies are proteins the immune system produces to fight disease-carrying organisms. Research has shown IVIG can reduce fever and the risk of heart problems. The immunoglobulin used to treat Kawasaki disease is called gammaglobulin. After your child is given IVIG, their symptoms should improve within 36 hours. If their fever doesn't improve after 36 hours, they may be given a second dose of IVIG. Corticosteroids. Corticosteroids are a type of medication that contains hormones, which are powerful chemicals that have a wide range of effects on the body. They may be recommended if IVIG hasn't been effective, or if your child is found to have a high risk of heart problems. Read more about corticosteroids. After treatment. When your child is discharged from hospital, you should be given advice about how to care for them at home. This may include making sure they're as comfortable as possible and they drink plenty of fluids. Make sure your child continues taking any medication that's been prescribed for them and look out for any side effects. Your child will be given a follow-up appointment and their heart will continue to be monitored. Once an ultrasound scan of the heart echocardiogram has confirmed that your child doesn't have any heart abnormalities, they can usually stop taking aspirin. Full recovery could take around 6 weeks, but may take longer in some children. Follow-up treatment may be needed if your child develops further complications. Kawasaki disease causes the blood vessels to become inflamed and swollen, which can lead to complications in the blood vessels that supply blood to the heart coronary arteries. Around 25% of children with Kawasaki disease experience complications with their heart. If the condition goes untreated, complications can be fatal in about 2 to 3% of cases. Because of this, the condition has become the leading cause of acquired heart disease that develops after birth, in the UK.